Last month, health authorities announced the first case of Ebola in Uganda, and currently to date, Uganda has so far registered 90 cases, 28 recoveries and 28 deaths. As the Ministry of Health struggles to contain the spread of the virus, today it confirmed the first cases of Ebola in Kampala.
I have Makindye 1, Nansana 1, that is Wakiso, and Seguku 2. So literally we are talking about 12 in Kampala, 3 in Wakiso. Basically we are talking about 15 in Kampala Metropolitan Area.
Dr. Mwebesa, who was addressing journalists at a training on Ebola reporting organized by the Africa Center for Media Excellence, says they are facing a challenge of people operating private clinics who do not follow the guidelines. Dr. Mwebesa says the Ministry of Health is now planning for a sensitization campaign.
Especially the small private clinics. These people come, they don't even take history. Like this man, it was very clear he came from Kasanda, and he's coming with fever, he's coming with the headache, and he's coming from Kasanda. The immediate thing you should ask yourself, why did you run from Kasanda? Why did you run from Ebola? The first thing you should do is to isolate that person. And the private clinics are not doing that. So we have started a big program of educating them, telling them it's not money first, it is your health first.
According to Dr. Mwebesa, it will not be easy to trace contacts in Kampala city given its population, but they will try to quarantine all contacts.
By contact, we bring you out, whether you have signs or not. Because you'll be there, yet you are having the Ebola, but you are not yet, it cannot be detected in your blood. So you have to come out, we keep you in isolation, we test you when you develop the symptoms. But even when you test negative, we still don't release you. We have to repeat the test after 72 hours until we are very sure that you are actually negative.
Dr. Mohamed El-Moni, the UNICEF country representative, says the most important thing right now is to prevent infections.
All of that is about how do we communicate to the people, how do we mobilize people to behave in the most appropriate way to protect themselves and protect the community around themselves. And for people to get the right information, to be mobilized to do the right things, it's the media who can mobilize them or not mobilize them. And it's the responsible media usually that mobilizes them by sharing with them the right information and advising them on what the right protective behavior is.
Dr. Ivan Chimuli from the World Health Organization says early identification of cases and treatment of symptoms will greatly increase the chances of survival. He also explains why discharged people are given condoms.
One of the sites it goes and may hide, and it may be slowly, it can only be slowly taken out, is the testicles. Okay, so the semen that comes from the testicles is definitely going to have this virus over time. But over time, the titers or the volume or the amounts that are released in the semen are going to reduce. So we keep following them up. It's just a peculiar thing about this virus, hiding.
This is the 5th outbreak of Ebola virus in Uganda and the Sudan strain. Ebola spreads through contact with the bodily fluids of an infected person.